Welcome to the show, everyone. Today I have Dr. Dom Nischwitz. Dr. Dom is a leader in biological dentistry and ceramic implantology. As vice president of the International Society for Metal-Free Implantology, he is dedicated to transforming oral health with metal-free holistic treatments. In 2015, he co-founded the DNA Health and Aesthetic Center for Biologic Dentistry in Tübingen, Germany, and has since placed over 5,000 ceramic implants. Blending cutting-edge science with natural health, Dr. Dom's mission is clear. Optimal health starts in the mouth. As an international speaker, best-selling author of It's All in Your Mouth, and a consistent promoter of his mission online, Dr. Dom is dedicated to educating both practitioners and the public, expanding access to biodentistry. Through his Institute of Biologic Dentistry, he trains traditional dentists in proper biologic dentistry practices, is on the mission to setting a global standard of biological dentistry and making biodentistry 3.0 more widely available across the globe. In line with his mission, Dr. Dom lives by example and is an intrinsically driven health enthusiast and sports-minded inspiration for many. Today, we're excited to talk to Dr. Dom about internationally recognized biologic dentist, speaker, and author of the best-selling book, It's All in Your Mouth. He's here to help us connect the dots between oral health, detox, and how removing what doesn't belong in the body can unlock healing. Welcome, Dr. Dom.
The views and opinions expressed by guests on this podcast are solely their own and do not necessarily reflect the views, opinions, or medical guidance of Dr. Robert Whitfield.
Dr. Dom, I have a ton of patients with implant-related problems, and so I take care of patients with breast implant-related issues and chronic inflammation from them, and you care for patients with dental implants and chronic inflammation from that. So I get asked all the time by my clients, what should I do first? And maybe this is a great segue for you, because I always say, hey, if the biologic dentist says this is the priority, then you take care of that first, because I can deal with the breast implants in the order in which it needs to happen.
Yeah, 100%. If I would say that what comes first, if the mouth or the breast, do you want this question answered?
Yeah, because they ask me a lot, what should I do first? And the breast component is a very big psychosocial situation for them. So maybe the lower lying fruit, not easier by any means, or less difficult to get done probably, but still working to lower inflammation and maybe discuss findings or things that clarify it for patients who are worried about this as a problem.
Yeah, so basically what we both do is setting the terrain. So making sure that body is back to its natural state. I mean, implant is an implant. It is, hasn't been there when you came out of your mom, so to speak. So yes, dentistry is very good when it comes to restoring the bite and function, conventional dentistry, but also very good in using materials that are just not very foreign to the body. So we're talking metals. We're the only medical profession leaving dead body parts in the body, like root canals, and also by removing teeth generally in a non-prepared state, leading to chronic silent inflammation in the jawbone called cavitations that are not even taught in university yet. So yes, there is a lot of room for health optimization when you look at previous dental work. And like when we talked in Austin, my goal is obviously biological dentistry, kind of like trailblaze the word, but biological dentistry doesn't mean anything. It's like there's no standard, no trademark, nothing that makes it clear for a future patient or guest what is happening here. So that's why I'm creating a global biological dental standard, the BGS, that is overlapping the high-tech manual work that you're familiar with integrative medicine, health optimization, functional medicine, to make clear that this is a path forward. And I could personally not say what should come first. However, seeing lots of cases, you cannot imagine how much of foreign stuff and that stuff is in a mouth of a patient. So oftentimes that needs sorting, because it's affecting the whole nervous and immune system. As you know, the mouth or the teeth are an extension of the brain. So it's very central to the nervous system. So that would be maybe a priority, because of course, breast implants are not as close to central systems, but obviously also a chronic inflammation. So whatever your body needs to deal with.
Well, I was going to say to that point, like if they're having so much problem with their oral microbiome and their oral health, and they have chronic low-grade infection and or inflammation and gum disease and pain and things that limit their, I think we're not saying the quiet part out loud. If you can't get in your nutrition, it really doesn't matter. You have to focus on being able to get nutrition into the body, and the oral cavity is the beginning of that.
Yeah.
And it's probably underappreciated how complex it is. People just kind of take for granted. And my own personal story, you'll like this. So I did microsurgery for 19 years, very high stakes, very high stress, standing, looking through the microscope. What do you think I was doing all the time with my teeth?
And
Grinding
probably
them.
grinding, like
So I
pressing on
literally
them.
ground down my teeth so much so that I made myself have obstructive sleep apnea because I already had a narrow airway. And then my wife started hitting me. It's like, you're snoring. I'm like, I'm not, I don't snore. I'm not some heavy person. I don't have a weird jaw. And obviously, now knowing what I know now, I'm very, very aware of obstructive sleep apnea, but also aware of maybe how I didn't take care of my own teeth, and led to all sorts of dental work and things now where I sleep with a mouth guard, and I have to have my teeth pulled forward, and it's a sleep apnea mask. Oh my gosh, it's all the things. Like it's a lot of extra stuff that if we can help any patients avoid, I would love to help do that, because you have to prioritize your oral cavity, if you will, to prioritize your brain, which is basically, if you don't get enough oxygen, you're going to get Alzheimer's earlier. You're going to have all sorts of things downstream that we neither of us want.
Exactly, and also adding up to the obstructive version. So basically, you lost bite height from grinding. So what happens if you lose just a millimeter? It's just a millimeter. It's like almost nothing of bite height. You have 50% less blood coming to the brain, and also less lymphatic system to drain at nighttime. So you're definitely adding up to the Alzheimer's also by that.
So let's
Besides,
pause
obviously,
there.
the
And
airway problems.
you say that again. So loss of a millimeter,
Yeah, there's
decrease
studies showing this is 50% less blood flow to and from the brain.
some blood flow. Okay. So consequently, like everybody listening needs to understand how important this is. Like, and when you don't think you don't have sleep apnea, a lot of people who don't snore who have sleep apnea, like you need to get a study done to show this in many instances. And women, especially, Dr. Dom, they don't snore but have sleep apnea.
Yeah, and yeah, exactly. Sleep apnea is another thing, and it's also multifactorial. It could be related to just swollen tissues from bleeding gums. Could be just like you said, the nutrition, intolerance to dairy, whatever, lots of mucus, but also previous dental repair, like swollen gums from metal restorations or
Yeah.
from dead teeth, or also just obstructed, or let's say swollen um, tonsils can also oftentimes just be the causation could be just toxins draining from dead teeth, cavitations, and everything. So we have to like see this all together. We cannot just address one and then just address nutrition or address function and put let's say put a mouth tape on your mouth and then learn nose breathing while the root cause is not gone yet. So that would
I
be
just said it. I was thinking about mouth tape. I'm like, we have to talk about this because I get asked all the time about mouth taping. And obviously, if you have a bad airway, mouth taping is not going to help you.
no, it's probably going to add up to the problem. So
Right.
but in the world of biohacking and health optimization, mouse taping sometimes seem to be like a miraculous thing, and it might be a good tool, but you have to time it strategically and have to see the big picture.
Yeah, I tell all my patients, I'm like, look, uh, if you don't understand your airway, if you don't understand whether or not you have sleep apnea, those things need to get sorted out before you start taping your mouth shut
Yes.
and creating a mechanical issue. Because as you know, if you say, for instance, have a narrow airway like I do in the back, and your jaw's not pulled forward, and you mouth tape, that's a problem.
Yeah,
You're just creating
100%.
more obstruction.
Of course, you probably then have more apnea and it doesn't
Yeah.
fix anything. That's what I mean. Like sometimes social media or like skimming through just the internet won't actually solve the issue. It sometimes just leads to not seeing the forest for the trees anymore. At least that's what I feel is happening these days. That, I mean, it's good that there's a health movement out there and that our patients taking control. They're finding you. They learn about breast cancer illness or breast implant problems, or they learn about root canals. But then at the same time, they get scared about everything in the minutia too. Like a little bit of xylitol here and there will kill me now, and they don't see like
Right.
you know what I mean? Like,
Yeah, it's hard to parse out the information, so to
it's
speak.
really hard. I mean, that's why there are experts out there that can maybe guide you. I mean, that's probably our main goal, guiding our guests to the next
So
level.
I'm sure too, because I was raised a long time ago. I'll be 56 shortly, and I had metal fillings, the usual, things, and
You
I
had it
got
all.
all those removed and replaced, and all the stuff has been done the proper way, based on the principles you espouse. So maybe for the audience, hey, if you have metal fillings, Dr. Dom is going to give you like a little snippet about how to think about getting those addressed and the questions to ask, really, like when someone's going to go to their dentist to have those addressed and made into and you propose the material ceramic or something that you recommend.
Yeah. So first of all, how do you know if you have metals in the mouth? So mainly we're talking about, number one would be the silverish black looking fillings. They're called amalgam fillings. That's what Dr. Rob probably just pointed towards. So those
Yeah.
are actually the standard treatment up until last year, also in Europe. The insurance pays for it. They're not silver. They are 50% mercury, which is the most toxic non-radioactive element known to men. So they're highly toxic. And on a daily basis, you kind of like intoxicating yourself with a tiny little bit of mercury vapor, but this adds up. Chewing, brushing, grinding, whatever. However, I don't want anyone to listen to this and freak out and go to their dentist and say, just drill them out. Just lately had a video on this. The main thing is we're just giving you more information. They are toxic, but it's also important to work on a strategy to find someone who knows how to remove them super safely. And this is involving multifold and protection mechanisms to not intoxicate you further, because just drilling out that filling will lead to a massive toxic event. And this is actually what oftentimes I have seen with patients when they got sick. They got them drilled out because of thinking, hey, it's going to help me, but then they actually got sicker because of this event. So find someone who is trained to remove those
Right.
safely. And it's not just the rubber dam that's cutting it. It's way more.
Right, because it was like almost like the exhaust you're speaking of, like from the drilling and the disbursement.
Exactly. Literally, I just lately posted something on Instagram where I'm reacting to a video where I just see a dentist removing an amalgam film, just drilling into it. So what we usually would do is we avoid drilling at all and we just break it out in parts so that we don't expose a lot. Having a
Sure.
rubber dam around it. So a rubber dam is essentially a rubber foil, and you only see the tooth. So stuff that breaks out will fall into it, but it doesn't protect the patient from the vapor. And the vapor is the main thing because this goes through everything, even through your cell. Then we have obviously a massive suction and a air filter that grabs 99.9%, which is also very important for you as a dentist or the
Right,
assistants. They are
right,
getting intoxicated all day long. I mean,
right.
there's multiple folds. We even use IV treatments. We prepare our patients with the right nutrition and detoxification strategies up before. Lots to learn, but there are certified real biodentists that know how to do this and smart certified. So it's existing. So the main thing I want to say is just everything we talk about, see this as new information, nothing to freak out, just knowing, oh, wow, there might be room to further optimize my health here.
Right, and Dr. Dom's giving you the right way to go about it. It's like you have to just have the right questions, in your head to ask if you're going to go, see someone to talk about it. I think
Yes.
that's always part of it too. Like, I don't envy, myself. If I sat in front of you and asked the questions, like I wouldn't know all the different things to ask you regarding how to go about it. I rely on you to do that, and provide that opinion. Um, you mentioned root canals and cavitations. And I've had some different conversations with biologic dentists. And I guess for me, for everybody listening who knows my methodology, I take out the scar capsule around an implant with each surgery, and I send that off to get tested for bacteria, fungus, mycobacterium. I don't do any virus testing. I've talked to biologic dentists who have even more bandwidth and do virus testing, things of that. And certainly, having worked with orthopedics for long periods of time and did reconstruction to help them after tumor resection or trauma or whatever, having optimized bone health, any infected bone being removed from a field or necrotic bone, maybe kind of speak to that so people kind of understand these words like cavity and cavitation and root canal, because it's a little,
Yeah.
you don't really understand all that. So like people throwing those words out at you, and it's a whole new language.
Okay, got you. So basically, I'm asking three questions. Number one, we already covered. Is there any metal in your mouth? Not just the black silver fillings, but also titanium implants, gold fillings, gold crowns. If that's a yes, there's room for optimization. We can go deeper. The next thing he was touching is, have you ever had a root canal treatment? So a lot of times it's referred to a root canal. Have you had a root canal? A root canal, essentially, and anatomically speaking, is the vital part of the tooth. So having a root canal is actually wrong. So it's about a root canal filling is the question. So that implicates you had a massive cavity, you had maximum pain, and the solution for the dentist was to take out the vital parts of a tooth. They're in the root. That's the nerve supply, the blood supply, lymph supply, and actually give you, take the pain away and then fill it up with some sort of materials to keep that tooth from biting. So that's when you have a root canal treatment, long-term biting solution, fine art in dentistry. However, it is essentially, when it comes to optimal health and overall health, it's flawed because it's a dead tissue now. And if you look at it from a microscopic structure, you have about 10 to 75,000 little tiny tubules, where now, just as Rob said, anaerobic bacteria, parasites, viruses, fungi can live in there, and it becomes a chronic it becomes a chronic infection. And if you have an immune system, which I hope for, then it becomes a chronic silent inflammation, oftentimes presenting with cysts. Something that is chronic usually doesn't hurt anymore, which is the main issue. You can bite on it for ages, but maybe silently draining your energy, blocking your autonomic nervous system, putting you into stress mode. It's, like I said, an ingrown splinter in your jawbone, which is an extension of your brain. So that is a root canal treatment, including the point of view from a biological dentist that does biodentistry 3.0. So it's, from our opinion, not a good idea to keep a dead body part in the body. And Rob will probably attest to this. It's not allowed in any medical discipline to leave something dead in the body. It's only dentists that put function, in this case, biting, over overall health. Or am I not right? Like, would you be allowed to leave a gangrenous toe on a patient or a gangrenous finger in medicine? I'm sure you wouldn't.
Yeah, this is the thing, when it was posed to me first like that, I thought, oh wow, I didn't really consider that, because in plastic surgery, conceptually, we would get called and you would have met me, Dr. Dom, if you had like a jaw cancer. So I would have made your new mandible out of your fibula. Or
Yeah, of
if you
course.
had a breast cancer or a woman and had a mastectomy, I could reconstruct the breast. Or if you had a sarcoma or some other defect from trauma or infection, we would debride all the bad tissue, to your point, make everything vital again, and then
Exactly.
for the exposed structures, bone, nerve, blood vessels, with a healthy piece of tissue from another part of the body, which was what I did with microsurgery. We would never leave anything dead, anything implanted and dead, any prosthetic that was, infected. So we're all kind of in lockstep here on this show, talking about we don't leave things that are devitalized or inert objects that are infected in someone. So I'm glad you posed it that way, because I've never had a root canal, so I didn't have.
Luckily.
Yeah. Exactly.
So, I mean, root canal again, the question is always, I don't want to fearmonger anybody. So, a root canal is a fine art. However, I know how most people don't get like a very good endodontist doing it.
Mhm.
And the question is always, where I come from is optimal health, meaning it's not absence of disease. I'm literally interested in you thriving on every single level. So if you already optimizing your health and something is still off and you're not superhuman, there's nagging issues, could be brain fog, could be inflammation, could be skin issues, could be depression, and you tried everything. That's when I say, okay, maybe you have overlooked the root canal. Could be the splinter holding you back, not to fearmonger you. And then there is solutions for it, which we can touch later. And the third one that you asked, so a cavity, just in medical terms, is literally just a hole in your tooth that tooth decay, basically. Cavitation is basically a chronic silent inflammation in your jawbone, kind of like really a cave in your jawbone that didn't really grow back after a surgery. That's why my third question I'm always asking is, did they pull your wisdom teeth? And if that
Okay.
is a yes, in about 90% of all cases, it leads to cavitations because the surgery was traumatic. You weren't prepared systemically for bone healing. You might have been a teenager, but definitely not fully anabolically supported to heal systemically. And then it adds up in a cavitation, basically a chronic ongoing construction site. Again, no immune system, dead tissue, necrotic, and perfect cave for anaerobic bacteria, parasites, viruses, fungi. A lot of fungi, especially mold in the US, live
Yeah.
there. They live there because it also harbors oftentimes heavy metals, it harbors glyphosates. And you know that fungi in nature are there to decompose something.
Yeah.
So it's an area that is dead. So it's basically the fungi is not the bad guy. It just loves that environment. So what we need to do is create a new ecosystem, set the terrain again for healing. Make this chronic thing and decompose that part of your body healthy again. Like he said, revitalize it. That's what we need to do.
So what would be the best, because I always think like, okay, diagnostically, what's a good way to answer that question outside of your history taking and expertise? Is there a specific diagnostic study, CAT scan, bone scan, some specific scan you do, X-ray of the jaw to identify the cavitation?
So literally most people I see remotely, they fly actually in from all over the world. So I just need a panoramic X-ray. For us, it's clear that if there's a missing tooth, we would suspect, oh, above 80% of all cases, there's cavitation. As soon as you're in the clinic, we would do a three-dimensional X-ray to confirm diagnosis, or preliminary diagnosis, confirm it clinically and with radiograph. 3D X-ray is a cone beam scan, CBCT. This is what you need. However, I realize saying this that about only 10 to 15, no, probably only 10% of all conventional dentists out there do have a CBCT. And now within these 10%, probably only 0.001% know what a cavitation is. So they wouldn't even diagnose it even if you had a cone beam. That's the main problem. It's not medical, it's not university curriculum yet to know what a cavitation is. And secondly, to know how to diagnose it. So that is a new set of skills. It comes with a lot of experience, either surgically, but also to just know what to spot on a 3D
So
scan.
if this is I always love doing this now because I get prompted all the time. And I think, and maybe you agree or disagree with this, but I, when I think of, and I recently had this happen to a patient woke up with a lot of anxiety and traumatic kind of, to me, PTSD after anesthesia.
Yes.
But there was always concern because I operate, obviously, and so the patient ultimately we did a CAT scan, and probably just like you from your training and years of experience, and I don't do this anymore, obviously, because I'm not in trauma anymore. I don't see those things, but in my head, I immediately made the CT scan a specific window to look at it, to look for specific things.
Exactly.
And then because of all the years and many scans I'd looked at, as soon as I looked at it, I ran it myself and I looked at it and I knew it was fine. And so I went out and told the mom, patient's fine. And then, you know, this is where I see things like AI being super helpful because just to your point, the practitioners aren't taught. And if this makes sense, I feel like radiology is the perfect place for AI to really upgrade and help because
100%.
practitioners who can't or don't have your skill set or mine or my experience or your experience can't just sit there and go, oh yeah, it's fine. They
Yeah,
could
exactly.
they could overcall it or undercall it and make an error, really, really difficult, error to recover from either way. Or to your point, they weren't taught it. It's not super simple for them to see, even if they had the right tech, because they can't interpret it properly. But if, you know, this is where I think like there is so much room for AI in medicine as it relates to interpretation of like a radiograph quickly to give to the practitioner and say, hey, like this is the read based on what Dr. Dom helped us learn to better understand this. You know, there's a cavitation right here because it lined up with their history, and here's their radiograph, and it
Yeah.
all like lines up.
Exactly. You have to have it all lots of experience, but you can I think you can actually train AI to do this best if the AI is trained by authentic intelligence in this case with
Oh
people
yeah,
that had the
for sure.
experience, obviously.
Yeah,
Then
yeah.
obviously, yeah, like I mean, AI is going to be amazing for a ton of things.
I just think imaging, like, it just seems like
Yeah,
such a natural fit because
it's a natural fit.
it's a bottleneck, right? If you couldn't interpret your own films, you would have to send them somewhere, and somebody'd have to read them, and then you
Yeah,
have to wait. And we used to always do that in training. They're like, "What did the radiologist say?" I'm like, "I don't give a shit what the radiologist said because if I don't trust what I see, I'm not going to go operate on someone based on what they think.
exactly.
Crazy." Like, you have
Yeah,
to be good
exactly.
enough to understand what's going on. Like, so to your point, it has to be trained properly, but then you get the full benefit.
Yeah, I agree 100%. So there's lots of room. I'm just realizing, like lately, because as you know, I train Biodentistry 3.0, the
Yeah.
future of our profession. I literally want to change our profession from the technician to the overall health experts. It's really the uplift of classic conventional dentistry. So not against it, it's just the next level because I think
Yeah.
it's outdated. But I realize in training certifying my real biodentist, that's how I call the tribe. There's certain levels, but I do realize for patient, the main thing I have in mind is our patients or the future guests. How can they find the right practitioner, and how can I make this visible? That there is also, even though you have all the knowledge, even though you have maybe the facilities and the machines, there's also experience that you obviously can maybe get faster by learning from someone who has this experience. But still, it's sometimes, when it comes to surgery, it's in the reps. You also have to do a set of reps. So if someone said, "Yeah, I'm a biological dentist, I have done," and on the webpage there is cavitation surgery.
Yeah.
But what does it mean? Did they do 10 or did they do like 10,000? How I did, like yourself, probably. So I've
Right.
placed ceramic implants is still, for example, I replace all root canals not with titanium implants, but with ceramic. Ceramic implants is 0.001% worldwide who is doing this, and I've placed one of the most worldwide. But how can a patient or guest notice? Like that a dentist can literally call themselves a ceramic implant specialist over a weekend course, and then they have placed one. You know what I
Yeah.
mean? Like that is the wild, wild west, and this is why I literally have a certification co-elevating with all the other dentists, doctors that are good, and then kind of create I imagine the future, the directory I'm having, I imagine it in sort of a gamified portal where it's clear that we are showing what is which level in a fair way, so we can in between we can say, hey, this guest for this work needs to see now in your case would be Dr. Rob or would be someone who is very skilled in surgeries. But for the final part, let's say putting on the teeth, you can go to this level too. But then it's fair for everyone and not a competitive thing, but it's more like we're also being accountable for each other. So I think that's the future of how we can make sure that real biological dentistry or biodentistry 3.0 will be the BGS, the biodentistry global standard. Because like myself, I have a quite high view per month and lots of people follow me. So if I tell you go see someone, it always falls back to us, right? It now needs to be clear.
We have the same issue because
Yeah.
people reach out to us and say, "Can you recommend someone here or there?" And I can't do that because I didn't train them. You're speaking the same language, and you're saying the quiet part out loud. Surgery in this case, biodentical. I'm sorry, biodentistry surgery is, as you said, something that's based on repetitions. Most folks don't really understand that one of the few things that you get uh, in medicine or dentistry, if you're a surgeon, you get better with repetition and time until you don't, till you lose
Yeah.
dexterity or neuroplasticity or whatever we're going to say. So I didn't. I didn't lose that when I stopped doing microsurgery. I had a problem with my neck and back, so it was more of a functional issue. But to your point, when you're working in those confined spaces, it takes lots of repetitions, both obviously understanding the surgical plan and then executing the steps in the plan to get the outcomes. And those are not a right out of training type of situation, typically.
One thing exactly, and also what I do, like I said, high-tech dentistry, even surgery, the skill set, this is excellence on all levels. This is the standard for us. But we also do have protocols running that have created over the time. Nutrition is on point. So we literally
Right.
prepare everyone for at least a month or more in advance. We scan their bodies once they're there. We know their body composition. So it's literally about the overall health project. We just start with the mouth and make sure giving our guests a perfect experience while they're there. They usually stay for like 5, 6, 7 days, depending on case size, flying in. And then on site, I don't know if you have the same, we do everything hyperbaric, IVs, laser in the vein, red light, hypoxia training, like a full, you would call it biohacking health optimization center, right? And
Right.
then
So
teach
Dom
them
and I
what to do. Huh?
Dom and I had barbecue in Austin. He didn't get to come to my clinic, but I have a human regenerator in my clinic. I have hyperbaric
Exactly.
chamber, red light, lymphatic massage from New Zealand, all the things that are necessary. Plus, we have a wonderful restaurant in Austin called The Well that has a gluten-free, dairy-free seed oil menu. So all the things that, you want your
Perfect.
patients to have. And then we have something called the SHARP method, which I wrote a book about, which is basically what you're describing. We do it for surgery, and you can expand it to cosmetic surgery or other forms of surgery, orthopedic surgery. Other plastic surgeons can use it. And we hope to have the same impact that I hear that you are wanting to have on dentistry so that patients are prepared so that after the fact you're not reacting to a problem that could have been avoided by just preparation. So
Exactly.
we have the same we're in alignment on that. I find it very frustrating when and you have patients who they learn about you and they're like, oh my gosh, I got to go see Dr. Dom right now. But that's not the best situation.
Also,
Preparation is always better than a emergency. Is it really an emergency? No, typically not. And if you can be prepared better, to Dr. Don's point, we're looking for the best outcomes for everybody so that there's not an extreme outcome of anyone. They're all relatively speaking the same.
exactly, because also what we're doing, like we literally take care of the complete previous dental repair. Usually that's a full mouth setup. So removing all metal safely, taking out all infected root canals, scarless, without any pain, placing ceramic implants, using ozone, PRF, taking care of your cavitations. Doing such a thing is high risk procedure. Doing this with almost no pain and swelling is almost unheard of, but this is only possible because we are so meticulous with, let's say, I call it a menu or the protocols. So maybe the surgery in itself is the stake of the menu, but being there with us, knowing exactly what to do when, being prepared, having an exact architecture of your health for the next 4 to 6 months, this will lead to the outcome. And obviously, we'll give you amazing teeth and perfect aesthetics and function, but that's just standard. And I realize more and more teaching so many people worldwide that it takes a long time to get there, even though some people have the facilities, the protocols are not running yet. And this is what I need to bring or want to change, that we have places worldwide where you can get this level of care. Obviously, it is hopefully later on tickling down to a broader set. But right now, I mean, you know how it is. To change something, you have to go from the tip. And then people, I think, it's always driven by the guests, the patients. And it's also like yourself wrote a book, I wrote a book about, yeah, to have maximum impact to help as many people out there as possible because they are having the chronic health
Right.
issues and are suffering.
Right.
And I
Yeah.
think they have the same problems with you. Like I have a lot, actually, we have a lot of overlapping patients. Probably they had it both. They had the mouth full of stuff and they had their breast implants to be removed because of biofilm, because of all the wrong ecosystem, more triggers. So yeah, it's all about making that body all natural again, basically, right? And helping
Yeah.
it to heal.
Yeah. I find that much like you're using ceramics to do the work now, I I know this may sound funny, but fat is the original filler. And so fat started being used late 1800s, early 1900s, and they didn't know how to use it. To your point, putting tissues in that aren't alive, you don't really get good results. So that's not something we would normally do. And with the advent of microsurgery in the 60s, you could transport tissue from one place to another, hook up the blood supply, and then voila, it works. And Dr. Dom's not saying this, but we'll just say the reason these things work when the tissues from your own body is because the immune system doesn't recognize it as foreign. Everything else gets recognized as foreign and gets attacked. And Joseph Murray won the Nobel Prize for doing a kidney transplant. And obviously, the technical aspects of that, hooking up an artery and a vein and the ureter in Siamese twins, which is how it was done, was a technical achievement. But in reality, it showed that the immune system was the identical immune system. So when you now change it to a non-identical twin or a cadaver kidney, now you have to introduce all the immunosuppression in order for the kidney to function. And that's how transplant surgery and transplant medicine really, that's how it came to the forefront. So fat is your own genetic material. So doing a breast augmentation or a buttock augmentation or facial augmentation with fat is, I hope to, much like you want to expand the awareness about biologic dentistry and ceramic use, I want the use of fat to be more widely understood as safe and effective.
I have a question regarding your specialty. So if you remove, let's say, usually it's probably silicon, right? That you remove. So you then replace it with own fat tissue that requires the guest or the patient to acquire some fat tissue probably upfront, right, in the preparation, if they don't have a lot, or is there always something to harvest?
Yeah, so it varies, right? So that is the most complex question. And what we've done is a lot of work on toxicity. So if people have a lot of toxicity burden with heavy metals and glyphosate, phthalates, and everything else, we don't do the fat transfer. I won't do the fat transfer. So I will wait and have them do detox with my detox team for several months and then repeat the test and see if they're a candidate.
So first of all, that is amazing. But you are aware of this because I would say literally, if you have done everything else, the biggest detox usually is taking out previous dental work. Because that's not something you can detox. But if you have a healthy body, like you just said, it stores in fat tissue or connective tissue if you have body fat. For athletes and people that are leaner, usually, unfortunately, it goes into the nervous system, brain, and these cells because that's the only storage form. So being very lean is not always healthy if your body is full of metals. So obviously, hearing this now, I can now tell you a real biological dentist should probably prepare those guests, have that all sorted with neutral materials, and then let's say 3 to 4 months later, you would run a complete extra chelation or something to get the rest of the body, but not as long as there's the source in the mouth. Like you would never do a chelation while you have mercury fillings. I see crazy things, so that's just actually the norm. And then obviously,
I'm glad you said that. I don't like chelation in the face of all these things going on.
No, you literally the biggest detox is taking out stuff that is in your body. You cannot biohack yourself. Like you literally have to go to a dentist to get rid of what the dentist put there. And people oftentimes are just not aware. And most, just saying this humbly, our most practitioners, health practitioners, sometimes just don't look in the mouth, and they just don't know that the root source of toxicity is there. And I've seen multiple patients that trying everything, or multiple thousands, for 29, 30, 40 years, no one finds anything. And the biggest detox would have been in their eyes, in the mouth, taking that rid. So if I show you pictures of what we harvest from someone's mouth, you cannot imagine. It's like literally crab metal, dead teeth, like everything for function. You can bite on it if you Terminator, but this obviously leaches into your system, like you just said, maybe in the fat tissue if you're lucky. So in order to get your patient clean for a future fat transplant, this is obviously part of the preparation to make that body clean. Because only then, if that is removed, let's say you wait 3 to 4 months to rebuild everything, then you can do a chelation, which means you could run IV nutrients that pull real toxins out of your system. There's nothing like binders and chlorella and these things you can do all the time. But literally, a medical chelation means
Right.
heavier things, EDTA, DMPS, so all the things that can pull. And then you can go to a very good level. And I think then you're probably prepared. But at the same time, what is if someone is very lean? You cannot do a fat tissue transplant, even though they would be clean, or is there always something?
Yeah, so I've gotten this reputation in the United States for doing these lower BMI, fat transfers, but I'm very particular now about having a body composition scan
Ah,
ahead
you
of
do that too?
time. Yeah, because obviously, um, just like people won't smile when they have bad teeth,
Yeah.
if they have been bullied or have trauma from a number of reasons and had a breast augmentation, reversing that and puts them back into that loop, that negative feedback loop, mentally. So when I can
Yeah.
provide that, I want to provide that, and that I'm sure, we'll just say all things being equal. Although people may want to come to see you to get their teeth sorted out, nobody actually wants to come see me because
I
I'm
understand the
I'm going to
psychological
have a
issue.
very negative psychosocial impact on them if I can't do something to avoid
Make
what
it, yeah.
initially the problem was. Right. So I tried to do my best whenever I can to one we always acknowledge that that's the problem, 100%, and trying to make sure that we do our best to help. But I am not, just like you're not, a psychologist or psychiatrist. We have to be aware, and I tell everybody the biggest thing always is self work, not work by Dr. Rob or Dr. Dom.
Yeah, that's correct. And also, same here, we always make sure that we are empowering our patients and guests to take responsibility themselves. So obviously, and kind of like we have to a little bit be psychologists, even though we're not clinically trained, but I mean, I get your point. They had this, yeah, negative view of themselves that led to breast semblance in the first place, and you take it away. That's probably a hard thing to swallow. But yeah, if anything is working out perfectly, and the patient would be healthy, you could still harvest body fat. There's always something.
Yeah. Yeah.
Yeah, where?
Yeah. Usually around the love handle area,
Ah,
inner outer thighs, abdomens. Abdomens are actually less of a a a bountiful area, if you want to think of it like that. And we use specialized instruments to not leave contour problems, because in thinner patients you have less of a layer, so you have to be aware of that always. We do things under local only, but in those low BMI patients where you need lots of areas, we do either IV sedation. And I try to make everything, I think you're also pointing out, this is an experience based situation. So
yes.
you want the patients and guests to have the best experience, as do we. So we take a great deal of care with our patients and the environments for them. We're building out a new center to do surgery the way I would prefer to have it done for my family, my friends, my patients. And so the environment is uh, in our control. I don't think people get that. There's the reason, right? People go to Germany to visit you. There's a reason why people go to Austin, Texas from Istanbul, Turkey, or Singapore to visit me. That's to have an experience that they're keen to have, and we want to make that the best they can have.
Exactly. 100% agreed. Same here, like a destination place. And also, to your point, we also only do local anesthesia. I do not do general anesthesia, not even sedation, because for that part I'm doing, maybe it's the same for you. You relieve a lot of trauma on different level, and having the guest or the patient being aware of what's happening. And I'm talking you through it. All the doctors that work with me, we're kind of like trained to talk you through it, because if it's all trauma, and we say the issues in the tissue. So this this should be a museum of life moment, and there is a change overall happening, so we can even measure real time that the body usually switches from sympathetic to parasympathetic if we
Yeah,
pull out stress. There are some people that are chronically in parasympathetic, that's existing too, and they get a little bit of sympathetic back, but usually it's the other way around. But we can measure that, and
right,
it's
right.
amazing. Like, it sometimes feels like you're in an yeah, people just start crying. You have to, and then emotions come up, and deep healing situations are happening. I love that it's a fulfilling part for me, but I understand that obviously for people that are new to this, dentists, training, all this, it sometimes is a lot of work, a lot of personal development also as the doctor to be needed to understand what we're really doing. So I see you do the same. So yeah, I
Yeah,
love
it's
that.
important to understand, and we should touch on this a little bit because I see it more and more, and it's not going to go away with the advent of artificial intelligence and how sophisticated it's become. The filters that are used on social media and the amount of
Yeah,
body dysmorphia that's already exists in society is going to grow because young people are seeing these very, very uh,
yeah,
perfect images, I guess I should say, and the filters and the setting these very, very unrealistic expectations of appearance, whether it's for teeth or breasts or body composition or hair or
100%.
whatever. None of that shit really is real. It's just not, and that's not going to bring you happiness. It's not going to make you part of a person who's present to have a discussion with Dr. Dom or myself, or it's not going to make you a better family member or friend or person in general. That's those things are not. Uh, they're not real. They're all really contrived, and the self work, whether it's a physician helping our patients or you teaching your physicians to help patients, they have to be aware of that. They have to be like able to process all those things and not discount them because they're
Yeah.
certainly there, and you have to be cognizant of them. And that's a very sensitive topic, but we see that routinely. So.
Yeah, 100% agree. That's obviously very difficult, different also to how we grew up. I mean, I'm a bit younger than you, but still probably more in your generation from growing up than younger ones. So even like for male, it's the same. I think there's a lot of dysmorphia out there.
Oh God, yes.
I just remember when I was like 18, 17, 18, and I wanted to be strong and muscular. When I now see the people that I was looking up to, I'm like, they look like no one has muscle. It was just, and
Yeah.
now everyone is like jacked, ripped, shredded. And if you see that as a 15-year-old, I can just see that it's like you have to have a strong like mind to understand how this works. It's not going to be overnight, and oftentimes, like you said, it's just fake. And
Yeah.
yeah,
You have to.
filters and stuff.
It's only going to get worse because the drugs coming are going to be better about burning fat and building muscle. So now, in a how do you want to say it? The GL1P agonists that started out um, that aren't very good, they're going to get so good that
Yes.
fat is not going to be a thing anymore. Like it will be easy to get rid of fat. The problem will be the opposite: how to put fat back on because you need a layer of fat, especially in your face, to look youthful.
Oh yeah.
And if you don't, you've already seen this in your clinic, I'm sure. People hollow out in their midface.
Yeah.
And that used to be the hallmark of something that was very stigmatizing. HIV atrophy happened from protease inhibitors, and drugs were brought to market, Sculptra being the main one, to fill the face. And I remember this drug came out in '05, and I had done HIV research in med school, and then the protease inhibitors came to the forefront and really controlled that disease, which is great, but it had this effect that was very stigmatizing to patients. So they brought this drug to market. Well, now it's going to be the cosmetic patient is going to have this problem because they're going
Oh,
to
right.
eat away their fat. And
It's not going to come
but
back then.
no, it's not. The minute you can do that, Dom, now you have accomplish
Yeah.
something. If you can, burn fat with one and then turn it on with another, now you have something. That is like the holy grail because now you take the thin person who doesn't have fat, who wants to have an augmentation, and you allow them to accumulate enough fat to then harvest to have an augmentation. Or the thing with fat transfers, and I should allude to this for the audience, is I don't overpromise anything.
Yeah.
A fat transfer is going to be based on someone's metabolism, health, sleep pattern, diet, all these other factors, hormone balance. And they asked me about longevity over time. Well, unless I kill you the day after I do it, I don't know what it's going to be like in 5 years or 10 years, because you have to live your life and you
Yeah.
have to be, present in your life, right? I tell everybody the same things. Like, you're going to go through menopause. The easiest thing for me to operate on is some, 20 something person with enough body fat who's in hormonal balance and doesn't eat like a trash can.
Yeah.
So that's pretty simple, right? All day long, I can do that. But then what changes is the canvas in front of Dr. Dom and myself. Like, it's always changing. And people
Yeah.
want the best outcomes all the time. So the best outcomes come from somebody being aware of all the things we're talking about: how you sleep, how you eat, quality of food, quality of fluid, quality of air, and things you put on your skin, which we haven't touched on, like your products that you apply to skin as a male or a female. Well, females typically apply a lot more products, but males do as well. They use like shaving cream and maybe whatever, one or two other things. And all those things contribute to toxicity, which we haven't really discussed, but they all play a role in how you accumulate over your lifetime all these different toxins.
Yeah. Obviously, the skin absorbs everything. Same as in the mouth. Like, conventional toothpaste is just the same thing. It's highly toxic. You can't,
Yeah.
I
Please
mean,
talk
it
about
says
toothpaste.
it's right. Toothpaste, it says it's a bunch of chemicals, and there's a warning sign. You shouldn't swallow it too much. And usually it says take a pea size of this. And
Right.
you know how it is. Usually
Not that big
you do the full thing. So 5 times the amount, twice a day, full of chemicals that you
one.
shouldn't use in your mouth. So that's why I also obviously created something that you actually should keep in your mouth. So my toothpaste, you should not spit out or rinse. You
Okay.
can spit it, but never rinse. You want to have it in your mouth, stay and be absorbed. That is the same probably you would do with a skincare. Something you should absorb. It should go in your cell. It has some peptides in it, maybe. It has some active ingredients that are not toxic to the system, but supportive. Same, I mean, the oral mucosa, the gum is the same as outside skin. It's outside body. It's not inside your body, even though it's in your mouth.
Right. That's something that, until I had to have all that, repair work done, I was not good at flossing. I would brush my teeth, of course, but now, I've got floss and a water pick and all the things now all the time, because everything gets caught in your teeth once you have all this dental work done.
True.
I think because I predominantly take care of females, I have a lot of discussions about products. I
Yeah,
just
I can see.
I'm like, because I'm getting asked all the time, should I use this or should I use that? What do you think about this? I get literally on text message, as you can imagine, all day long. What do you think about this technique? What do you think about this product? And you get it too, I'm sure. And you're just like, it's just a little tedious. But first of all, it's confusing to the consumers. Basically, just like the toothpaste industry has made it confusing to consumers. Like, which there's like a whole wall of toothpaste at the grocery store.
They're
They
all the same.
You have to go like, all right, which one do I? It's like the skincare thing. Like there's 19,000 things. Like, which one is the right one? Well, to Dr. Doss' point, it's the one that has the least amount of toxicity. And so your body's not going to get absorbing these things, because that's what your skin's going to do, is absorb it. So
Yeah, and I think there's more and more people thinking about these newer advances. I think there are more people, not many, but like us, questioning current belief systems, coming up with new creativity, new strategies, using what's there and trying to optimize things. But I think it also probably happens in skincare. I'm the wrong person to ask, because up until, let's say, 4 months ago, I never used any sort of cream on my face, nothing. And then I had like a hydrofacial
yeah,
thing. I didn't even know what that was until my partner implemented this. And then I had it, and I mean, it feels good. It's basically a professional cleaning. But
yeah,
then at the end, there's product that they put on your skin. And
yeah,
she said she needed the triple amount of product to just fill my body up, because it was so depleted of fluidity. So my skin was basically dried out.
yeah,
But this to know for me was very important, because if I would use a fat cream on my dried out skin, it wouldn't make any sense. I would have needed just fluids, like
yeah,
I don't know, gels or whatever. So
yeah.
now I do stuff for my face for the first time in 42 years. And yeah, I can see an improvement. So I understand why someone should use skincare. Makes sense now.
It does, and the women in my audience, they're obviously much more aware of this,
Of
and
course.
um, the hormonal influence, particularly estrogen, on the dermis and thickness of the dermis is very important. In males, we're more concerned about other things and not so much worrying about skincare and get all sorts of other issues because we're not paying attention to it. Um, I think like in closing, what I would say is Dr. Dom's in Europe and I'm in the US. We're very aligned in making sure that patients, one, are very engaged with their own health, like knowing more about yourself. So he has a program, I have a program. So those are, very specific to learning about your own health before going to see one of us. And then, taking some ownership, I guess, without lack of a better term in that, whether it's your oral health or overall health in general. So, like, what are you mentioned your toothpaste. So, like, what are some just basic tenets to take away that are actionable they can start doing now, so
Yeah.
that we've given a lot of information as usual, but like, what are some actionable steps to take?
Yeah. I think actionable steps would be just to understand there is let's say, an ideal oral healthcare protocol that you can implement straight away. So number one is ditch your conventional toothpaste that is loaded with fluoride and triclosan, SLS, sodium lauryl sulfide, saccharin, carrageenan, titanium dioxide. Just everything you find in the supermarket is copy and paste, all the same, even though the labels are different. You want to find something, and don't get it wrong, you don't want to just go with a natural toothpaste. You need something that has an active ingredient. So find a toothpaste that instead of fluoride has hydroxyapatite, because that's the stuff your tooth is made out of. Hydroxyapatite. I have not yet seen it in any supermarket in America or Europe. Usually it's only online, but you'll find it. Hydroxyapatite and no chemicals. You would you would basically want to eat it. If you're okay with eating this stuff, then put it into the mouth. So that would be an easy actionable step. Hydroxyapatite, xylitol maybe, coconut oil base. We have lactoferrin in it, which is protecting the gums. We do have a spore biotic in it that is immune modulating, so probiotic, and lots of different things. Toothpaste is not there yet for America, but it's probably going to be there hopefully in September, October, called More Than a Toothpaste. Number two, it is still good to do some. A lot of people I realize are mouthwashing with chemical mouthwashes. If you go in the supermarket, usually the blue, the green, the red stuff,
Right. Right.
that is highly acidic, um, ethanol-based crap designed to clean a floor or to nuke your oral microbiome. You don't want to do this. You don't want to put anything disinfecting in your mouth. There's a huge microbiome, bacteria that live with you. You need them as your first defense, as an immune system, for detoxification, for building NO. So super important to not kill it. Therefore, be nice to these bugs and just use coconut oil pulling. That is a Ayurvedic strategy. Literally, you just buy extra virgin coconut oil, take a teaspoon of it and put it in the mouth, swish it around for 5 to 15 minutes, ideally daily or every other day. Make it a habit. Otherwise, it doesn't even make any sense to do it. This is without any side effect, costs you nothing, penny costing, and it will soothe your microbiome. It will help your gums, your teeth, protects them, is antibacterial, antiviral, easy to implement. And number three would be copper tongue scraping or just tongue scraping. Tongue scraping means you have a specific scraper and you go to the back
Yeah.
of your tongue, just clean it every morning. I would do that first thing in the morning. Takes you 10 seconds. Again, habit is key. You just need to do it. Copper, why? Because copper in itself is an antibacterial material. And
Okay.
it's also like almost for free. You can buy it everywhere. So that would be the easiest strategy. When it comes to flossing, like you just alluded, if you had previous dental work, you might need to do it because the stuff gets stuck in between. Or
Yeah.
you still have a bad diet and you eat a lot of goldfish things or sticky food. You just need flossing, or let's say, I don't know how you call it. You know, these flosses that are in a clamp and then you go in between. This is good. Or you, like you said, a water pick is fine. I personally don't have any dental repair. I have very healthy teeth and they're all nice together. So if I personally use floss, I have a hard time getting it through. So what could happen is I yank it through and then my gum gets cut and I create a microtrauma, basically leaky gum. So I would want to avoid, in my opinion. But I realize most people listening had previous dental repair. So use some sort of floss. Try to find one that is microplastic free. Could be, for example, done by any sort of fiber, organic fiber. It is possible to find it. And then if you have this covered on a daily basis, the next thing is to use nutrition as well as micronutrients that support your teeth from within. So this everything else was from the outside, making it hard from the outside, polish it, help the saliva. Now we go from within, blood supply, because your teeth are living organs that
Right.
get their nutrients like a plant. And what you need is vitamin D3, vitamin K2, magnesium, zinc, boron, biotin, methylated B vitamins, lots of things. Like over a decade ago, I created a product called Bone and Teeth in Europe. It is also in America called Tooth Shield, Supreme Oral Health, which has it in a one-stop shop formula, kind of like your invisible mouth guard. So if you have the cleaning everything ready to support your life in your mouth and not kill it, then think about which nutrients you need to make your teeth hard as stone. Same time, your bones hard as stone is the same. And your hair will grow faster, your nail will grow faster because it's all the same systemic bone or tissue healing. Tooth Shield in America, Bone and Teeth in Europe. And then you kind of like have that part sorted. Before, like we already discussed, next level, at one point in the future, you want to have a real biological dentist, certified real biological dentist, look into your scan and give you an overview of what needs to be done to have that dental repair repaired once and for all, so that at one point in the future, you never have to see a dentist again. That's the main goal. But it's a step-by-step process. But the things you can do just right now, I think, are quite simple.
So that's a great summary. Then, for them to get a little bit more, for those who want to learn more about your programming and things you've done, where can they find you?
So I think we're probably going to send you some show notes, right? But
Yeah.
the easiest is actually Instagram. My handle is Dr. Dome. It's even though you say Dom, it's Dome in Germany, so Dome1, Dr. Dom1.
Okay.
And also you can go to drdomofficial.com. You find my clinic in Europe. You find the directory where you can find certified real biodentists in several levels. They're all over the world. And as a dentist, you will also find the Institute of Biological Dentistry where you can find the certification. So I think it's all in one on Dr. Dome Official and my book and everything. But yeah, I don't know if all the companies are on there, but even formulations and stuff, go to Instagram, you will probably find the best. And maybe
we'll
if
have
you do
all
show
that.
notes, we will send
Yeah.
it.
We'll have all this in the show notes. I just want to make sure we got it in there. I really appreciate having you on. It was great to meet you in Austin at the Health Optimization Summit.
Yeah,
And
that was cool.
obviously you're in Austin. We'll get you out. So thanks for coming on. I look forward to talking to you again soon.
100%. Thank you ever so much for having me.